Dr. Kevin Kavanagh is a retired ENT from Somerset, Kentucky. A number of years ago, he started an organization called Health Watch USA. Dr. K, good morning.
Good morning, Jack.
How did you start Health Watch USA? Why did you start it, and how did you start it? Just as a website?
No, we actually started as a nonprofit organization, and this was to promote patient safety. And this was a long time ago. We were concerned about safety incidents at a hospital. And this evolved then to primarily focusing on infectious disease because that was the one area that infected both the young and the old. And in order to correct the problem of hospital-acquired and healthcare-acquired infections, you really needed to have adequate nursing and staffing. And so it was kind of an overall overarching problem. And so we first started on MRSA, then concentrated on C. difficile. And so when COVID-19 came along, we were pretty much already in tune to our social advocacy and research integrity work with infectious disease, and it was a very good fit for us. So we've been quite active in this.
Yeah, and amazing your growths, through this.
Well, yes, and we've grown internationally also. Last Wednesday, we had a meeting where we actually had reports from around the world, everywhere from Germany to Peru, and we had little 10-minute descriptions of what's going on in their country. And we hope to have that up online and on our website at healthwatchusa.org in a couple of days.
A couple things I saw online this morning I wanted to bring up with you. Panel of CDC advisors recommending people get the Pfizer or Moderna COVID-19 vaccines over the single-dose J&J. Citing a rare blood clotting issue. 54 total cases, 9 deaths have been linked to the vaccine in the United States, with symptoms arriving within 2 weeks of getting the vaccine. The overall rate of developing TTS, and I'll get you to tell us about that, is still low, 3.8% of the cases per million, but is higher for women than men. And I think I heard, it's not part of this report I'm reading here, but I think I heard younger women that are, under 30 mostly?
Well, what they're saying now is women who are between 30 to 49 years old are at the highest risk. And the risk is still very low. The chances of having the blood clotting problems is 1 chance in 100,000. And the chances of death are 1.5 in 1,000,000. And that's for that age group and sex group. And so that is very, very uncommon. And this is how safe these vaccines are. So even a vaccine that has those rare risks are now being curtailed in that group of patients to make the vaccines even safer. So I would feel quite comfortable getting the vaccine and quite comfortable getting the booster. And I think this is becoming more and more imperative now that we're seeing data come in about the Omicron variant.
But if you have the choice, maybe stay away from the J&J, right?
Definitely. Why take a risk of 1 in 1,000,000 if you don't have to?
Right.
Correct.
You don't have to.
Correct.
This other story that I want to share with you, a new study out of Hong Kong claims that the Omicron variant replicates 70 times faster than Delta. Researchers say the virus can replicate in human airways at a much faster rate, but that the lung infection appears to be less severe than earlier virus strains. One researcher pointed out that even with a less severe infection, Omicron could lead to more cases of severe illness due to its fast-spreading nature. The study is currently under peer review. Do you find this report alarming, or does it suggest that COVID-19 might be easier to get under control?
No, I find it alarming because the problem is that this virus, Omicron, it is an escape mutation. And people are getting reinfections at a fairly high rate. It is less severe. It is causing possibly up to 30% less hospitalizations than the previous variants. But if it spreads 70 times more, if you do the math, that's going to overrun our healthcare system, especially if it's causing reinfections. Now, some of the data that we're currently basing this on is coming from an insurance company called Discovery Health out of South Africa. And it's based on a presentation that they gave. So there's no way of checking it or for me to look at the data right now. It's not been published,
I see.
but it's very concerning. They report that if you're vaccinated with a 2-dose mRNA vaccine, there's only a 33% protection against infection and a 70% protection against hospitalization. But the problem is, and this is what's very concerning, is that these were South Africans. The study was done in South Africa. And in South Africa, almost everybody has been vaccinated 2 doses within the last 6 months. Many the last 3 to 4 months. So they have fresh immunity to that vaccine. As in the United States, our most vulnerable populations were vaccinated way early in this year, and their immunity is waning and may be at severe risk. Now, the good part about this study is it shows the vaccines are effective against preventing severe disease, but it underscores the fact that if you're more than 6 months out from an mRNA vaccine, you absolutely have to get a booster. That is an imperative because you will not be adequately protected against Omicron.
Anyway, you sent me some information, and as you always do, and I want you to share with us the first thing on this list: 2 philosophies. Now, is this your work?
No, this is just what you pick up from the internet. And it's really true that some people are looking at this pandemic. What doesn't kill you makes you stronger. In other words, if you survive the infection, we're going to reach herd immunity and you're done with it. But many people, including myself, view this as what doesn't kill you mutates and tries again. And that's really what we're seeing with Omicron. There were a number of studies that were just released that were very encouraging about previous infections with protection against the Delta variant. One study showed that if you just get 1 dose of a vaccine, you have a 22-fold increase in antibodies if you had a previous infection. In other words, a 1-dose vaccine may be all that you're needed. But again, that's pre-Omicron. Another study from the Cleveland Clinic found that previous infections were 88% effective against symptomatic reinfections and 66% effective against asymptomatic reinfection. And that's good news. But again, that's not the Omicron variant. So I think there is now more data supporting that a previous infection gives you a degree of immunity, maybe greater than a 2-dose vaccine. But remember, I think now is going to be the standard, similar to most vaccines, that you're going to have a 3-dose of an mRNA vaccine to achieve any good type of immunity. So I really believe that we're on a way of learning more and more about this pandemic. But unfortunately, as this virus mutates, we really do need to keep our immunity up as high as possible. And that's whether or not you've had a previous infection or whether or not you've been vaccinated. You're going to need a booster or you're going to need the vaccine in the first place, depending upon what category you fall into.
Here's a text. Really a good question. It says, just tuned in, maybe I missed it. How many people have died from Omicron?
Right now, there have been a few that have been reported, but you need to remember that deaths are lagging indicators. And the problem isn't so much right now worrying about deaths, but crashing our healthcare system. And if you do that, people like myself who has other non-COVID problems aren't going to be able to get treated. As you know, Jack, I had to put off surgery for cancer for many months.
Right.
And initially the schedule was postponed a long time down the road, and then it got canceled. So that's the problem, is when you look at deaths, these are prolonged. And we're getting more and more data in of deaths far out, many years down the line, that may occur from these infections, because this isn't the flu. It infects every organ of the body, and you can get delayed type of problems. And Jack, it is something we need to take seriously. The other problem is that of costs. The cost to the healthcare system is going to be absolutely unbelievable. one hospitalization in the ICU in Kentucky has an asking price or out-of-network price of almost $250,000. A network price, in-network price, is about $188,000. That's just one patient. We're not going to be able to afford this. So we need to get off these political talking points and really start concentrating on public health, because Omicron has much greater ramifications than just worrying about one statistic, how many people die from it. Because believe me, people will be dying from it and also from collateral damage because of our healthcare system being overstrained. So we need to take this pandemic seriously.
Randy says with Pfizer wanting to hide their research for 70 years doesn't boost people's confidence. Now, this goes back to a question we had before about 50 years. That has now grown from 50 years to 70 years, that they will be releasing their information in 50 years. And I'm still extremely unclear on this. Can you shed any light on it at all?
Well, it has to do with intellectual property. These companies don't want to release their research because they don't want to have other people copying their product. I mean, they're for-profit companies. And so this is a problem. It's a problem of both oversight, getting the data. It's also a problem in making sure the world has vaccines. And this is one of the problems when you have a for-profit system. Of course, one of the advantages is that you have a very efficient machine that cranked out a vaccine in less than a year. But we need to push to try to get that data. That's not only just in this product, but in many other types of products, that data is often shielded behind an argument of intellectual property.
What else do we need to talk about this morning? I know we've got so much information here and a limited amount of time. Where do we go from here?
Well, I think one of the most important things is that if you're immunosuppressed, you now have another option, and that is to get monoclonal antibodies. The FDA has approved this. It appears to give up to 6 months protection for pre-Omicron variants, and that is important. There was a study out on 4 doses of mRNA vaccine to those that are immunosuppressed. And if they had a weak antibody response, which many do, there was only slight improvement. And if they didn't have an antibody response, there was no improvement. So a new option is there. That is getting monoclonal antibodies. Again, it may not help with the Omicron variant, but it will help with Delta, which is still here and wreaking havoc on our healthcare system.
How's that administered?
Well, it's IV. It's an infusion. You'd have to go in to a hospital or infusion center and have it go into your veins. And then the antibodies float around in your body for at least 6 months or so. This is similar to the protection that newborns have once they're born, having the antibodies of their mother, which, by the way, is another reason why, if you're pregnant, you should be vaccinated.
A member of our family was 90 years old and got COVID and got that monoclonal business, and it turned her around, I mean, almost immediately.
Yeah, and it has been very good. I'm not sure how well it's going to work with Omicron because it's immune escape properties. We just don't know. There's so many questions. And of course, I side on the side of caution. You know, if you don't know something, doesn't mean you should go do an activity that places you at risk. Maybe we should not do that until it's safe. So with the Omicron variant, you need to be very, very concerned if you are immunosuppressed.
I have a Fox News reporter that we have on quite frequently, Simon Owen in London. And man, I tell you, the United Kingdom is not fooling with this stuff.
Well, they're not, and neither are many other countries. They're very serious about it. They're advocating frequent testing, even if you're vaccinated. For example, our presenter, Dr. Myvald from Singapore, stated that in healthcare settings, if you're vaccinated for Omicron or for the SARS-CoV-2, you are tested twice a week. If you're unvaccinated, you're tested every day. And that's one of the reasons why I think this mandate of if you're unvaccinated, you're tested once a week, with a rapid test, that's probably not going to provide near adequate coverage. And if you're vaccinated, it doesn't mean you're out of the woods. You can still get infected. You could still spread the virus. And with Omicron, you can still get sick and wind up in the hospital. we have no idea of the incidence or problems of long COVID from this virus. And that's something, again, we just don't know. And with the rate it's spreading around our country, we need to be acting on the side of caution.
And we're so laser focused on Omicron right now, as I guess to some degree we should be, that are we losing sight of Delta in the meantime? It's still very much a thing, isn't it?
Well, it is. And hospitals are still filling. Our positivity rate in Kentucky is in the upper 8%, and we still have a number of deaths. I mean, my goodness, we're going to be up to 12,000 deaths pretty soon. And that's not good at all. And so I do think that, Jack, we need to be wearing masks. We need to be testing before large activities, even if you are vaccinated. And if Omicron starts to break out, we really need to think about cutting back on activities, not because of the individual. The individual may say, well, I'm vaccinated. This is a slightly less virulent virus. I may not get sick. The problem is, if you spread it, a lot of people are going to be exposed. The numbers of those catching it and becoming sick are going to increase, and that's going to fill our hospitals. And then if you have a heart attack or chest pain, you'll be waiting hours to be seen instead of taken care of promptly. And believe me, Delta has filled the hospitals. This has happened. Many states have gone into a triage mode. Unfortunately, Omicron has the potential of adding on another potential strain on our healthcare system, which I'm scared may result in, a near collapse. So I think we need to really follow public health advice, watch out for our fellow man, and please wear a mask, avoid indoor poorly ventilated settings, and start using at-home testing. We ordered ours from Sam's. I'll be honest with you, Jack, I'm here in South Carolina with my grandkids, and we've already got the grandkid crud. And Jack, we've been using these home tests for COVID right and left. They are very useful.
We are out of time, Dr. K. I will be out next week, as you know. I wish you'll be with Cruiser. I wish you and your family a very Merry Christmas, and we'll talk to you in a couple weeks.
Thank you very much, Jack.